Okay, today, let me get my slideshow from the beginning. Okay, hello. My name is Maria Horbe, and I will be giving my presentation on Parkinson's disease. Okay, so what is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder that affects movement control due to the loss of dopamine producing neurons in the brain. And the prevalence is that it affects 1 in 100 people over the age of 60. Some key points to take into consideration are it is progressive and it is incurable. So there are no cures at the moment, but that is something that they are working towards. It affects motor and non-motor functions. I'll get right into that here on this next slide. So um, most common and recognizable symptoms. So, some signs that you may be familiar with, or if you've known somebody who may have tremors, posture might be different, tremors in the legs, tremors in the hands, difficulty with movement, and, maybe their posture is a little bit more hunched over, as you can kind of see in the image here on the right. So the motor symptoms, obviously, as I just mentioned, it's a disease related to the basal ganglia. So it includes the disorders of posture and locomotion. So the first one being called hypokinesia, and hypokinesia is more the absence of movement, extremely slowed movement. And then bradykinesia is also the slowness in like an initiation. So someone might struggle with starting to walk. They may be fine walking, but then once they stop, that initiation to start walking again may be a little bit more difficult. And then some non-motor symptoms. So obviously, as these symptoms increase and get worse, there might be more signs of depression, cognitive decline, sleep disturbances, and just overall, their mental health might just decline slowly. Okay, so from the early stages, so from symptom progression from first onset, once detected, and this could be at any age. Again, typically it's at an older age demographic, but you can detect at an earlier age. So the first symptoms would be mild, so tremoring in maybe one hand, slight stiffness, and then slow movements. And the patient is still able to perform daily tasks. So they are still able to, communicate with you and I, walk normal, do the same things that we're doing day to day, and may not be as affected by it. The middle stage, so this is where signs might start to become a little bit more prevalent, and you may notice them a little bit more, where they worsen, balance becomes impaired, walking gets a little bit more difficult, and then the increased need for assistance. So just with daily activities, whether that's brushing their teeth, putting on their clothes, feeding themselves. This is a really big issue with people with Parkinson's, is just holding the spoon up to their mouth. So, having those tremors and having something on a spoon or fork would lead you to have difficulties feeding yourself. And then in the later stages, so severe motor and non-motor functions or symptoms. So this would require full-time care. They may already be in a home, or, just have a home health aide come to the home. And then there may be more of a cognitive decline. So, for example, like dementia. And then just a general time frame from the minute they're diagnosed with it is from 10 to 20 years. And obviously, case by case, and everyone, just depending on the severity of it, depending on how you take care of yourself and your previous health, may affect the 10 to 20 years. So, some factors that might lead to uh, progression might be the severity of the Parkinson's disease that you have diagnosed at the time. So, how bad it is at that moment, your response to the treatment. So, if you are, on some kind of medication, or, you're doing physical therapy, or you're doing something, how you're responding to that, how well you're putting in effort into doing that. So, it really just depends. And then age of diagnosis, and also if there's any other medical conditions that were relevant from before. So heart disease, diabetes, etc. Okay. Then, oops. So prevalence and population affected. So over 10 million people globally live with Parkinson's disease. So it is very common. And again, this is common in individuals that are over 60, but it can still affect people under 60. There could be an early onset of Parkinson's disease, um, that may be detected sooner than later. Some risk factors, age, genetics. So if you know somebody in your family, your mom or dad, uh, that has Parkinson's disease, it may be something you look into earlier just to get, tested sooner than later. Environmental factors, this could be any pesticides, where you're living, health hazards, things like that. It is more common in men as well. Some other personal impacts that Parkinson's affect would be your place of employment. So, if you are doing like a hands-on physical task, for example, let's say you're working in a factory and you have to constantly do things with your hands, your time might be slowed, your, accuracy, how you're working may be affected. Long-term disability is going to kick in, and then your retirement might be affected uh, with having Parkinson's. So there's a lot of things that could affect just your overall place of employment. Ideally, you know, you would slowly phase out and make it work with wherever you are working, and hopefully they work with you. So relationships can be affected by this too. Emotional strain on family, friends, caregivers. So if you are, husband and wife and you have a partner and or you have kids too, if you're unable to care for your kids, that puts a lot more strain on your partner. If you are unable to care for your partner, that obviously takes a toll because they're going to be having to put more time and effort into taking care of you. So, there may be some emotional strain there, and then a loss of independence. So you may not be able to do the same things you have always done by yourself. You may need help, as I mentioned earlier, feeding yourself. You may need help getting dressed, things like that, and just overall interdependence. So, even bathing could be a huge issue for someone with severe Parkinson's disease. So, known causes. So, we have genetics, genetic mutations, lifestyle, so environmental toxins, also head injuries. So, injuries that happen later on in life could also impact that. Age, so mostly common after 60, and then other risk factors. So family history, exposure to chemicals, rural living. So depending on, your environment and then just in general, how you're taking care of yourself, what you're, eating, what your overall health habits are. Brain structures that are affected are your basal ganglia, and which affects the motor coordination, and then your substantia nigra. So this is the loss of dopamine producing neurons. You can see here where the basal ganglia and the substantia nigra are in the brain. And then preventative approaches. So obviously it's not 100% preventable, but some things that can change or lessen the severity might be exercise, healthy diet, avoiding environmental toxins. So just your overall lifestyle. Medications, so dopamine agonists. This may delay symptoms or, lessen the progression of them. And then deep brain stimulation is also part of the preventative approaches, which is just a lot more invasive. So surgical intervention to stimulate certain brain areas. Okay. And cognitive neuroscience research in non-human animals. So in this research, there was effects on rats and monkeys. So in the lab, researchers tried to replicate Parkinson's disease symptoms by manipulating genes or toxins to animals, which were mimicking the motor and non-motor functions. So then in behavioral tests, they were using to assess the motor skills and just kind of see how the animals were showing the signs of Parkinson's. Non-motor symptoms such as depression and cognitive impairment were also evaluated using behavioral tests. And then the rodent models were particularly useful because they were cost effective, obviously, and genetically flexible. So we have had, oh, sorry, um, so they're genetically flexible and we're able to stimulate more areas in the rodents, but their brains are a lot more simpler, so it causes a less of a correlation from them to humans. So, obviously the goal is to eventually find a cure for Parkinson's disease, but when we're doing tests on rodents or other animals, their brains are not going to be closely related to ours. So we would have to find other ways to try to mimic the same thing in a human brain. So yeah, so they're using, obviously there's no cure for Parkinson's disease yet. But with the new technologies like gene editing, stem cell therapy, and protein-based treatments, ideally we are on the up. So APA animal care and use guidelines, ethical standards ensure humane treatment and care for animals in research. Obviously, so we want to make sure that the animals, whether they're rats or monkeys, are being treated respectfully and humanely while doing research. And then just in general, balance scientific advancement. So the cost benefit reward must make sense and correlate with the ethical concerns as well. Human treatment goals. So development of neuroprotective drugs that could slow or stop disease progression. Obviously, this would be something that people could take, whether that's orally or an injection of whatever type that would slow down the progression of Parkinson's or eventually stop it completely. Um, Advances in gene therapy, as I mentioned before, are getting closer and closer to, being able to do more things with like gene editing or stem cell therapy to be able to treat other things and with the hopes of including Parkinson's disorder as well. And new treatments targeting non-motor symptoms. So cognitive decline and depression, obviously besides stopping the physical impairments, being able to work with the mental health impairments as well. Disease prevention. So having better early detection through biomarkers or imaging techniques. So being able to detect at a sooner age, even prior to it even showing up, like signs or symptoms showing up, being able to test whether or not you may be a future candidate to having Parkinson's disorder would be, disease prevention, and then development of vaccines to prevent or delay. So as I mentioned earlier, slowing disease, so stem cell therapy, replacing lost dopamine producing neurons, and then gene editing. So gene editing techniques to repair the genetic mutations associated with Parkinson's. And as I was talking, I had briefly touched base on the experiment that I went through with the monkeys and rodents. So the use of that in detecting Parkinson's and how they were trying to work with those animals. Um, the research was crucial for advancing our understanding, just overall seeing how the cognitive decline and their physical decline with their motor functions were affecting the rodents as well. And then overall, Parkinson's is a complex disorder. So progressive disorder with a significant impact on an individual's motor functions, quality of life, and daily independence. So ongoing research is obviously a work in progress, and we are going towards it. So we're going towards coming up with more better quality solutions and interventions and preventions. So our treatments are improving the more and more research that is being done. And just in general, future outlook. So continued advancements in medical and technological research does offer hope in improving outcomes for individuals living with Parkinson's. Just seeing all the research that has been done, there are more and more research being done that is providing a lot more of a positive outlook on the prevention, on the cure, on everything that's associated with trying to manage Parkinson's disorder. So that is my presentation for you. Thank you for listening.